There are 4 principles of biomedical ethics: respect for autonomy, beneficence, non-maleficence, and justice. Difficulties arise when they conflict, and the scenario of involuntary treatment is one of them. Specifically, it's a conflict between respect for autonomy and beneficence, which is a duty to help others. Let's consider a hypothetical scenario. Let's say there's a 50-year-old patient who has a gangrenous foot due to unmanaged diabetes. The medical team is recommending amputation because the patient might die otherwise. Importantly, the patient does not want the amputation, but also does not want to die. The surrogate, on the other hand, wants the surgery. What do you do in this case? The American bioethical standard is that patient refusal ought to be respected if they have decision-making capacity. When patients lack capacity, decisions are to be made in conjunction with the surrogate, and a surrogate can consent to a treatment on behalf of the patient even if the patient isn't agreeable. However, even in these cases, treatment won't be forced in every circumstance. It depends on the details. In this case, it's ethically appropriate to proceed with the amputation if the patient lacks decision-making capacity. The justification is that it's good for the patient. Okay, it's the result of fulfilling the duty of beneficence. But again, if the patient has capacity, then respect for autonomy trumps beneficence. Okay, I've so far mentioned decision-making capacity multiple times. What is it? Decision-making capacity is a technical term. It refers to a capacity that's constituted by 4 subcapacities: understanding, appreciation, reasoning, and communication. Understanding means grasping the fundamental meaning of information communicated by the physician. Appreciation means acknowledging the medical condition and likely consequences of treatment options. Reasoning means engaging in a rational process of manipulating the relevant information. And communication means being able to clearly indicate a preferred treatment option. A patient must possess all 4 subcapacities in order to possess decision-making capacity, okay? And capacity is assessed by a physician. The reason why I'm talking about this is because it's one of the first questions that's asked when a patient refuses recommended care. Do they have capacity? If they don't have capacity, then you start working with a surrogate. It changes the trajectory of the decision-making process. The patient no longer has the authority. All right, let's consider a different case. Let's say there's a 50-year-old dialysis patient who has recently become non-compliant with his dialysis. He has even gotten to the point where he's become physical with the care team. The patient says he doesn't want to live anymore, but he lacks capacity. The surrogate wants the patient to continue to receive dialysis. All right, so what do you do in this case? This case is a bit different than the previous one because this patient needs to receive dialysis multiple times a week for the rest of his life. Like, that's just how dialysis works. This is an important difference because it means that if we force dialysis onto him, we'll have to do it over and over again. If it's the case that we would have to force treatment onto someone continually, then I would recommend against it because while the patient lacks capacity, we want to value his preferences to some degree. Even if he doesn't have decision-making capacity, the fact that he doesn't want it means something. It has value. Just like in the case of kids, children don't possess decision-making capacity, generally speaking, but we do value their preferences to some degree. Additionally, the fact that this patient becomes physical places the care team at risk of harm every single time. So that's another reason not to force treatment continually. Before I end this video, I want to clarify something. Just because a patient refuses recommended treatment does not mean they lack capacity, okay? You can have capacity and refuse because maybe the treatment doesn't align with your values. And the medical team should honor that refusal. They should not force treatment onto you, even if it means you're going to pass. You can refuse life-saving care as long as you have capacity. All right, I'm going to end it here. I hope you learned something interesting, and I'll see you all next time.